Good morning, students. Today's topic is submandibular and sublingual salivary glands. The other two salivary glands that we have to discuss. We have already discussed about the largest one, the parotid gland, and now the two salivary glands that will occupy the submandibular region, that is the submandibular as well as the sublingual salivary glands, will be discussed in two video lectures. So let's begin with the part 1 of anatomy of submandibular and sublingual gland. Now, what is submandibular gland, or how to define or how to introduce submandibular gland? The largest one is the parotid gland, as we have already discussed about it. Now, the second largest one, or the large gland, the large as compared to the sublingual. This is the sublingual salivary gland. So, as compared to sublingual salivary gland, it is big in size or large in size, but smaller than the parotid one. So the large salivary gland, which is basically of a size of walnut, having J-shaped, roughly J-shaped, and is indented by the mylohyoid muscle, the posterior border. This is the anterior border of mylohyoid muscle, this is the posterior border. So this posterior border of mylohyoid muscle will indent this submandibular salivary gland, dividing it into two parts: the larger one, the superficial part of the submandibular gland, and the deeper part or the smaller part. And this submandibular gland basically will open through this submandibular duct, or called as Wharton's duct, which will be discussed further in a different slide. Now अब सुपरफिशियल पार्ट और डीप पार्ट दोनों को सेपरेटली हम डिस्कस करेंगे. सो सुपरफिशियल, टॉकिंग अबाउट सुपरफिशियल पार्ट of this submandibular gland, this superficial part basically fills or totally occupies the digastric triangle. Digastric triangle वापस थोड़ा सा चल लेते हैं. Digastric triangle का बाउंड्रीज डिफाइन कर लेते हैं, रिवाइज कर लेते हैं. ऑलरेडी इंटीरियर ट्राइंगल ऑफ द नेक में मैंने आपको ऑलरेडी डिस्कस किया था दिस सब डिविजन, द डायगैस्ट्रिक ट्राइंगल, विच बेसिकली हैज द फॉलोइंग बाउंड्रीज. द एंटेरो inferior boundary, the antero-inferior boundary is formed by the anterior belly of digastric muscle. This is the anterior belly of digastric muscle. The posterior-inferior boundary will be formed by the posterior belly of the digastric muscle, and the superior boundary or the base will be formed by the base of the mandible. So this is the digastric triangle, which is totally occupied by this superficial part of the submandibular gland. Now, this superficial part of submandibular gland has three surfaces: the lateral surface, yes, then the medial surface in continuation of this mylohyoid line, the medial surface, and the inferior surface or the superficial surface, the inferior surface or the superficial surface. Now this superficial or the whole of the submandibular gland is enclosed by a covering fascia, which is nothing but investing layer of the deep cervical fascia, which divides into a superficial lamina or layer and the deep lamina or layer. This superficial lamina or superficial layer of the cervical fascia will covers basically the inferior surface of this gland, submandibular gland, and this deep lamina or deep cervical fascia, deep layer of cervical fascia will covers the medial surface of the salivary gland. This deep lamina will be inserted into the mylohyoid line. This deep lamina will be inserted into the mylohyoid line, and this superficial lamina will be attached to the base of the mandible. So this is the base of the mandible, this is the mylohyoid line of the mandible, and deep layer will be attached to the mylohyoid line, and superficial layer will be attached to the base of the mandible. Now we will define relations of the submandibular gland, basically the superficial part of the submandibular gland. So we will define the relation as we have already discussed or defined the surfaces. So inferior surface या superficial surface का relation define करेंगे पहले, then we will define about the medial surface relation. Medial surface relation जो है वो तीन layers में, तीन parts में define होंगे. तो जो anterior part का medial surface का relation है वो यहाँ define करेंगे. So first of all, relations of the inferior surface. So we have from outwards within or from outwards within का मतलब बाहर से अंदर की तरफ चल रहे हैं. So outermost layer is the skin, when followed by the superficial fascia covering the platysma. chiasma. Then we have the cervical branch of the facial nerve, we have the facial vein, we have the deep fascia, okay, and then last but not the least we have the submandibular lymph nodes. So these are the relations of the inferior or superficial layer of the submandibular gland. Now talking about the relations of the medial surface. So medial surface of the superficial part of the submandibular gland will be discussed under three parts. The anterior part, relations of the anterior part will be the mylohyoid muscle, the mylohyoid muscle, the mylohyoid nerve एंड द माइलोहायोइड वेसल्स. यहाँ पे सिर्फ आर्टरी बिल्ट है बट वेन भी साथ में यहाँ यहीं पे वेन है. सो द माइलोहायोइड वेसल्स, माइलोहायोइड नर्व एंड माइलोहायोइड मसल will be in the relation of anterior part of the medial surface of the superficial part of submandibular gland. Now talking about the relation of other two parts, that is the middle part of the medial surface, the middle part of the medial surface, this is the medial surface. So the middle part of the medial surface and the posterior part of the medial surface. So middle part of the medial surface में जो relation में है, we have the hypoglossus muscle, the styloglossus muscle, the hypoglossal nerve and the lingual nerve. So these four structure will be in relation of the middle part of the medial surface of superficial part of the submandibular gland, and the posterior part of the medial surface of superficial part of submandibular gland will have the styloglossus, lower part of the styloglossus muscle, the stylohyoid muscle and ligament. Then we have the ninth cranial nerve, that is the glossopharyngeal nerve, and the wall of pharynx, which is not shown in this figure. So these are the structures that are in the posterior part relation of the medial surface of this superficial part of submandibular gland. Now talking about the lateral, this is the lateral surface, this is the lateral surface, and talking about the lateral surface relation, we will have the mandibular fossa, the mandibular fossa of the mandible. Then we have the insertion of medial pterygoid, and lastly we have the facial artery. So facial artery, insertion of medial pterygoid and mandibular fossa of the mandible will be in relation of the lateral surface of superficial part of the submandibular gland. Now talking about deep part. So deep part is the small part, it is compared to the superficial part, it is smaller in size. So and this deep part is formed, this submandibular gland is basically divided into the superficial part and deep part due to this indentation by the mylohyoid muscle. So position or situation of this deep part can be defined with the help of mylohyoid muscle and hypoglossus muscle. You can see in this figure that this deep part of the submandibular gland is situated superficial to the hypoglossus muscle, whereas deep to the mylohyoid muscle, or you can also say that this deep part is in between the mylohyoid muscle and the hypoglossus muscle. Okay, now what more we can see here, that posteriorly it is continuous to the superficial part around the posterior border of the mylohyoid muscle. तो mylohyoid muscle जो है उसके posterior part में यहाँ पे continuous है, देखो posteriorly it is continuous with the superficial part around, यहाँ this is the यहाँ इसकी बात कर रहा हूँ, this region, इस side की बात कर रहा हूँ. So posteriorly this deep part is in continuation with the posterior border of the mylohyoid muscle, and anteriorly अगर बात करें तो it is extending up to the posterior end of the sublingual gland. This is sublingual gland, and इसके ये this is the anterior end of sublingual gland, this is the posterior end of sublingual gland, and this is the anterior end or anterior part of the deep part of submandibular gland. So this anterior end of the deep part of submandibular gland will extend till the posterior end of the sublingual gland. Now talking about relations of this deep part, तो अगर डीप पार्ट का बात करें रिलेशंस का, तो बेसिकली हमने पहली बात तो ये डिफाइन किया कि जब ये माइलोहायोइड और हाइपोग्लॉसस के बीच में है, यानी इट इज़ डीप टू द माइलोहायोइड मसल एंड सुपरफिशियल टू द हाइपोग्लॉसस मसल. सो वैसे ही रिलेशन डिफाइन कर लेते हैं. सो सुपरफिशियल हाइपोग्लॉसस मसल के है तो हाइपोग्लॉसस मसल के ऊपर हुआ, सो मीडियल Lateral to this deep part is the mylohyoid muscle, and medial to this deep part is the hypoglossus muscle. So lateral relation में mylohyoid muscle, medial relation में hypoglossus muscle. Then we have above, we have the lingual nerve and with the submandibular ganglion. The lingual nerve and the submandibular ganglion. Submandibular ganglion यहाँ labeled नहीं है. This is the submandibular ganglion जहाँ मैं cursor दिखा रहा हूँ, and this is the lingual nerve. So above we have, above this deep part we have the submandibular ganglion and the lingual nerve, and below this we have the hypoglossal nerve. Now talking about the submandibular duct or the Wharton's duct. This submandibular duct or the Wharton's duct, this is the submandibular duct or the Wharton's duct, which is basically very thin walled. हमने जब parietal gland का duct, parietal duct का बात किया था तो उसमें पढ़ा था कि वो thick walled था, but as compared to parietal duct, this Wharton duct is not thick walled but a thin walled duct, which is around or approximately 5 centimeters in length. See, this is approximately 5 centimeters in length, and basically it emerges from the anterior end of this deep part of submandibular gland. This is the superficial part of the submandibular gland, this is the deep part of the submandibular gland, and through this anterior end of the deep part of the submandibular gland, this Wharton's duct will originate. It will run forward, yes, it will run forward, and forward where on the hypoglossus muscle. This is hypoglossus muscle, and look here, it is running forwards on the hypoglossus muscle in between the lingual and the hypoglossus nerve. This is the lingual nerve and this is the hypoglossus nerve. So in between the lingual nerve and the hypoglossus nerve, this will run on the hypoglossus muscle, and it will run forward, it will run anteriorly, and basically at the anterior border of the hypoglossus muscle. This is the anterior border of hypoglossus muscle, this is the posterior border of hypoglossus muscle. So at the anterior border of hypoglossus muscle, you can see this duct crosses the lingual nerve. This duct is crossed by the lingual nerve, and it basically opens at the floor of the mouth. It opens at the floor of the mouth on the summit of the sublingual papilla. It basically opens on the sublingual papilla. So yahan, this is the sublingual papilla, and this Wharton duct will open into this sublingual summit of this sublingual papilla, basically at the sides of the frenulum of the tongue. This is the frenulum of the tongue. This is the this is tongue, ये tongue है, and this is the frenulum of the tongue, and to both sides of this frenulum of the tongue at the summit of the sublingual papilla, the Wharton duct will open. Okay, so that is all for today. We will discuss more about the blood supply, the lymphatics, the nerve supply of submandibular gland. Then we will discuss about the sublingual gland also, and we will discuss about clinicals of both these salivary glands in detail in next video lecture. Till then, stay home, stay healthy, take care. Thank you so much.